Today we're diving into a really interesting and important study about how chronic loneliness can increase the risk of stroke in older adults. This new research sheds light on the long-term effects of loneliness, and you might be surprised at just how much it can impact your health. Let's break it down. But before, welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. Please like, subscribe, and share to help this channel grow. So loneliness has been linked to many health issues in the past, but did you know it's now considered a significant risk factor for strokes? To simplify, so stroke happens when blood flow to the brain is blocked or a blood vessel in the brain bursts. Stroke can lead to long-term disability or even death. And here's where it gets more concerning. New research shows that chronic loneliness can dramatically increase the risk of stroke. In a recently published study, the reference is included in the description below, research looked at the data from over 12,000 older adults in the US who were stroke-free at the beginning of the study. They followed these participants over 10 to 12 years, and here's what they found. The study focused on how loneliness changes over time using a validated loneliness scale. So participants were grouped into categories: those who had high loneliness consistently, those whose loneliness increased, then those whose loneliness decreased, and finally those who report consistently low levels of loneliness. Here are the key takeaways. Individuals who experienced consistently high loneliness over the years had a 56% higher risk of having a stroke compared to those who reported low loneliness. Even after adjusting for factors like depression and social isolation, this risk remained significant. The study shows that chronic loneliness, feeling persistently isolated over time, has a much more serious impact than just feeling lonely for short periods. It's not just about being alone, it's the long-term psychological strain that really takes a toll on the brain and heart. But how does loneliness lead to stroke? Well, researchers suggest a few possible mechanisms. For one, loneliness can lead to an increased stress and inflammation in the body in general, and both of which are known to increase the risk of cardiovascular issues, including strokes. Chronic loneliness can also affect behaviors like medication compliance, adherence, physical activity, and even sleep quality. So what can we do about it? Well, it's clear that addressing loneliness is not just about mental well-being, it's also crucial for our physical health. Interventions aimed at reducing loneliness, especially in older adults, may be key to lowering stroke risk. Activities such that foster social connections, like joining community groups or engaging in some regular social activities, could make a big difference. So in summary, loneliness is more than just a feeling. It's a health risk factor that deserves attention, especially in older adults. This new study really highlights how chronic loneliness can increase the risk of stroke. If you or someone you know feeling persistently lonely, reaching out and building connections could be a literal lifesaver. Thank you so much for watching. If you found this information helpful, don't forget to share it with others and stay connected and stay healthy. If you love medicine and the medical topics that we discuss on this channel, then you would love my book that is now available on Amazon. It is titled The Clear Skin Diet: Unlocking the Secret Link Between Food Sensitivities and Skin Health. Transform your skin by identifying your trigger foods and how they affect your gut microbiome, immune system, and hormones. The link is below. Thank you so much.